The hysterectomy is the most common surgery in women worldwide. Over 90% of hysterectomies are done for benign indications such as endometriosis, pelvic pain, abnormal bleeding, fibroids, and also the hysterectomy is done to treat many gynecologic cancers. If you or someone you know is having a hysterectomy, watch this video because I'm going to talk about ways to improve your recovery and how to optimize your health after surgery. Well, if you're new here, welcome. My name is Dr. DuPont. I'm a board-certified gynecologic oncologist, and I'm passionate about educating women on how to improve their lives, and I believe that begins with great health. Today, I'm going to talk about the robotic hysterectomy or total laparoscopic hysterectomy and how you can improve your recovery after surgery. Well, as I mentioned, hysterectomy is the most common surgery performed in women. It is the #1 overall. And a lot of patients who have hysterectomies, some women are relieved because their bleeding stopped or their pain has improved. Other women feel different because, their body has changed and their womb has been removed. So for many different reasons, people will have different experiences after a hysterectomy. But today we're going to talk about the laparoscopic or robotic hysterectomy. That's one of the most common surgeries done currently to remove the uterus. Now, when we're thinking about a laparoscopic hysterectomy, it's a minimally invasive approach to removing the uterus. So when I was in training, we learned a lot how to do the hysterectomy kind of the old-fashioned way with the big, large incision. Now that does improve our visualizations as physicians, allows us to see much better, allows us to remove big masses or tumors or cancers. But nowadays we're trying to be less invasive, use small incisions so the patients will have less complications during surgery, but also quicker recovery. And so one of the ways that's being done is with the robotic hysterectomy. Now, the robotic hysterectomy is usually an outpatient procedure. You may go home that day or the next day. And what patients really love about it is that they have less pain, they're in the hospital for a shorter amount of time, and they have fewer complications, and they're up and about much faster. So when you get home, there's some things that I want you to know about in terms of, is this normal or not normal as you recover from your hysterectomy. And so some complications that I want you to be aware of or to think in the back of your mind mainly deal with infections, so port site infections. Because you do have smaller incisions, you're less likely to get infected, but it can happen. So if you're getting, a red discharge, purulent discharge, or if your incision is painful or just red and spreading, let your doctor or your healthcare provider know because that's not normal. You can also get bladder infections after surgery as well as pneumonias. So, your healthcare provider will talk about, deep breathing and you may get an apparatus called spirometry that may help you take deep breaths after surgery. And then if you have sensation in your bladder that feels painful, or you're getting blood in your urine, then you may have a bladder infection. So those are things to be aware of. Some other complications after surgery that aren't as common but can happen would be swelling in your legs, could be a deep vein thrombosis or blood clot in your legs, or even a pulmonary embolism. Those are very rare, but they do happen. And the ways to prevent that is to increase your activity. So when you're home, we don't want you in bed all day or sitting in the chair. We want you up and moving daily just so that you prevent complications of a blood clot. Other things that are important infections are things like injury to the bowel. So if you're having abdominal pain that's not getting better every day, definitely let your provider know. And then injury to other organs around the uterus, such as the bladder or the urinary tract, such as the ureters. Those complications don't always show up very quickly after surgery, but if you're having a lot of fluid come out of your vagina, if you're having a lot of blood in your urine, definitely let your healthcare provider know because those are some things that we worry about. And some of those signs also that you'll notice something may be wrong is fever. You may have, a high fever. So definitely if you have, a fever that's not getting better, let your healthcare provider know. Other things that can happen after surgery are cardiac issues. You can have arrhythmias, you can have heart attacks. They're very uncommon in younger age groups, but the surgery's done in women, with cancer and in older women. So definitely if you're having chest pain that's not going away, you're having trouble breathing, you should go to the emergency room, especially if you recently had surgery. Now, some other things that to think about in terms of complications after surgery that are very common and that usually aren't serious is you might have some gas pain. You may feel bloated, you may have some right shoulder pain. Now that's usually from the CO2 gas, and that usually will go away over time. And then other symptoms, you may have some pressure when you urinate. Sometimes patients will tell me they just feel different when they're urinating. Now keep in mind the bladder is right above the uterus, so during a hysterectomy you may notice some changes, and in most of my patients I notice it does go away in several weeks to a month. And then other things you may notice is some spotting. Now your doctor will probably tell you you will have spotting for anywhere from 2 to 4 weeks after surgery. Now if you're having hemorrhaging, that's abnormal, so definitely let your doctor know. But if you're having spotting that's just going on for a while, a lot of times that is normal. Definitely when you see your doctor for your post-op visit, let them know. We usually will check the vaginal cuff or the top of the vagina, usually at the second post-operative visit. So if you're having some concerns, you're having discharge or foul-smelling odor to your discharge, let your doctor know or your healthcare provider right away, because those sutures that close the vaginal cuff may not be healing properly, or sometimes they come loose very easily and you may have more drainage. But definitely let your doctor know, because they're looking for any problems with the suture or the vaginal cuff, and they're also looking for signs of infection or cuff cellulitis. So those are some of the things that I want you to be aware of. But the main thing that I want you to do is definitely move. The more you move, the better you do, the quicker you recover. And then also, you probably were given pain medicine before you left the hospital for your surgery. A lot of patients do well with just Motrin or Tylenol or non-steroidals. They'll alternate. But if you were given narcotic pain medicines, please use them sparingly. We don't want you to suffer or be in pain, but we also don't want you to take them like candy. They can cause constipation. A lot of patients notice with narcotic pain medicines, sometimes they make you nauseated. So, oftentimes we'll say, take it with food. If you're having a lot of constipation, usually we would advise you to take a stool softener, or you can take things like increase your fiber in your diet, or drink prune juice, or eat prunes themselves. Prunes actually work wonders. When I was a student, we'd have nurses that say, oh, I'm going to warm up some prune juice, and most people don't like prune juice, but it works. I promise you. I had surgery and a friend of mine got me some prune juice. I think he got me like a 6-pack of prune juice. I only drank one because it did the trick. And so just keep in mind there are some fruits and vegetables that you can increase in your diet that will help your constipation. And then keep in mind, a lot of the pain medicines you were given in the hospital, some of the nausea medicines also may cause constipation. So definitely make sure your bowels move. I usually would advise my patients before surgery to take a stool softener for several days, or to increase their fiber intake. Remember, you need 25 grams of fiber a day to have the right dose or right amount of fiber, and most women don't get that much. So just keep in mind that before surgery, you're most likely going to be constipated after surgery, so try to fix those issues after surgery. Well, my nurse had surgery 2 months ago. She had a robotic hysterectomy for endometriosis, and she wanted to share her experiences. So listen to this video to get some of the things that she went through after surgery. Now, one good thing about what she's going to tell you is that she had surgery and she experienced it kind of from a nursing perspective and a patient's perspective. So she's going to give you some tips and tricks on how to improve your recovery.
Hi everyone, my name's Amanda. I'm the nurse here with Dr. DuPont. I recently had a hysterectomy. I had a robotic hysterectomy, and I just wanted to share some things that really helped me along in my recovery. So the first thing that I would like to talk about is the referred gas pain. When you have an abdominal, a robotic or laparoscopic surgery of any kind, they have to put gas in to help the surgeon see better. So when they try to do the best they can to get all of that gas out, but some of it gets trapped in the body and it has to be absorbed. So it causes irritation to the nerves, and you get what's called a referred pain it's typically in your back right shoulder blade and your ribs, and it hurts to take a deep breath. So some things that really helped me to get through that was a heating pad. You can get either one that plugs in, but I really liked having one that I could microwave and put on and take it with me wherever I needed to go. Another thing that really helps is walking. The more that you walk, and not to exert yourself after a major surgery, but walking around your kitchen or your living room, something to help get that traveling. Another thing that helped me was simethicone. Simethicone tablets you can get over the counter at any retail store, but always make sure that you discuss with your provider to make sure that you've discussed all of your medications and you don't want to mix anything that you're not supposed to. But if it's allowed, simethicone tablets really, really help. Another thing that helped me was to stand up and get a shower and just let the hot water run on my back. These things really, really helped me. Another thing that you deal with is bloating. You've had an abdominal surgery. There's swelling, there's air trapped. You're going to have a lot of swelling and you'll feel that discomfort. Another thing that I really noticed, something that really stuck with me during recovery, is pain. Always make sure that you take your pain medicine as prescribed and keep on top of it. Make sure that you're doing it on scheduled intervals, because once pain gets out of control, it's really difficult to get back under control. And at the end of the day, you may feel good all day long and you've gone without your medication, but then at the end of the day, you're going to have that crash. It's going to be very painful. As well as, one of the things that you really want to focus on whenever you're taking all of the narcotic medication is how it affects your GI tract. You've had surgery, you've been put to sleep, there's all this inflammation, and you're taking narcotics. So it really does a number on your GI tract. Everything is really slow moving. You do not want to deal with constipation on top of recovering from that abdominal surgery. So it's always helpful to take some over-the-counter stool softeners. Again, discuss this with your doctor beforehand. But just taking them as directed, as prescribed, staying on top of your pain medication, and help take those stool softeners. Another thing that will help your gut along the way, drinking something warm. Warm tea, warm coffee, juices such as apple juice, prune juice, grape juice. Those things will help stimulate everything as well also. The last thing that I really want to share is the fatigue. I am a very active person, and after the first 3 or 4 days, once I got over those first few days, I was ready to get back into it. I wanted to go to the grocery store. I wanted to do the laundry. I wanted to do the dishes. And that's not the same for everybody. That was just my experience. But I noticed as I felt the energy to do those things, I would do them and I would immediately crash. I had no fatigue. Going to the grocery store was the worst thing that I could have done. I ended up in one of the scooters, and even that was too much for me. So just pace yourself. Understand that you've been through a major surgery and give yourself some grace. So the wound care with the incision. So I had a robotic hysterectomy. So I had 4 little incisions, 1 through my belly button, 1 off to the side, and 2 off to this side. They were glued. I kept them dry, I kept them clean. I left the steri strips on there. Do not mess with the steri strips. You want them to fall off on their own. So as long as you're keeping it clean and you're not messing with it, they should heal really well. If you notice any redness or irritation or any drainage, always talk to your doctor about it. Always seek medical advice from a medical professional. An abdominal hysterectomy, the incisions are quite different, and it's a completely different recovery at that point.
Well, I hope that video from Amanda was helpful. If you had surgery yourself or you're having surgery coming up and you have comments you want to share with others, please put them in the link below. I hope you enjoyed this video. If you did like it, please give me a thumbs up. And if you haven't already subscribed, please subscribe. And please share this video with a friend or a family member who you think may find it helpful. And continue watching this video next. Thank you for watching, and I'll see you next time. Bye-bye.